Hi, I'm Jeff Pearson. I work at the Therapy Center in Jennings, Louisiana, and today we will talk about workplace postures. Sitting workplace posture can often be considered like an orthopedic perfect storm. It's headaches, cervical pain, shoulder dysfunction, decreased muscle length and flexibility, also low back pain, along with other things. What we're going to do here first is make a posture assessment on this subject. A couple of things the subject is doing wrong. She has a forward head posture. As you can see, her head is not stacked over her shoulders, and this creates a very heavy head and stress over the neck muscles. Also rounded shoulders, which can cause shoulder impingement syndrome, also possible rotator cuff dysfunction. Sometimes improper desk height can cause carpal tunnel at the wrist. Sitting for a prolonged period of time can cause muscle length problems at the hip and hamstrings. And also sitting with a slump posture can cause disc degeneration of the low back. Okay, what we're going to do now is move the subject from sitting in poor posture to a more proper alignment. First, what we'll do is have her sit up a little taller through her lumbar spine. We'll get her knees bent at 90 degrees and ask her to pull her shoulders back slightly. And this, a lot of times, just through these movements here, it'll correct the head posture. But if she was doing forward head, she would make sure her chin is tucked back and her head stacked over her shoulders again. A couple solutions that a person could do for themselves to help improve posture would be to add a lumbar roll. This will create a little bit of lordosis in the low back and get the spine in better alignment. Also, an exercise for the cervical spine can be chin tucks. The subject here will perform a couple for us. What she's going to do is retract the head and try to get the head stacked further back on the spine, creating better flexibility and alignment. And a third exercise, I'll have the subject turn and face. She can sit on one hand and take her opposite hand and grab the side of her head and just gently pull to the other side, stretching some of the cervical musculature. Two other exercises the subject can do throughout the daytime would be shoulder squeezes. What the patient is going to do is stand and then squeeze her shoulder blades together, opening up the chest, which is going to help strengthen the posture muscles in her upper back, along with creating better flexibility through her chest and prevent rounded shoulders. One other exercise she can do is she can find a corner of her room or a doorway and place her arms up on the wall and step through. Again, this would be a stretch to the anterior side of her body, which would improve alignment and flexibility. By removing some of the posture habits demonstrated today and also performing the posture tips, we will be able to maybe self-correct posture pain syndrome and feel much better. I'll leave you with a quote: "An ounce of prevention is worth a pound of cure."